Hello everyone, welcome to my channel. Today we are going to talk about an interesting entity which is very basic and important concept in neuroradiology. When you see a mass, you just need to discuss if the mass is interaxial or extra-axial. So basically, is it arising from the structures outside the brain parenchyma like the dura or like bone or other outside structures, or is actually arising from the brain parenchyma itself? Okay, let's dive in and just give you some tips to differentiate these things, specifically for medical students, for like other disciplines, like besides radiology, and also for junior residents. There are some clues that helps you to define is the mass intraaxial or extraaxial. Okay, let's focus on this lesion that we see. This is a T2 sequence, as you see, the T2 sequence because we have the CSF bright in the ventricles. And basically you see that the scalp is also bright, so because the fat is bright. So I know this is a T2 sequence. I see a lesion. Actually, I see two lesions in the portofalcine area of the frontal lobe, and I see they are predominantly T2 isointense. And I see a little bit of edema in the brain parenchyma adjacent. I see a lot of mass effect, and I see these adjacent gyri. Looks like they are like compressing. The sulci are just getting effaced, and there is some mass effect on the ventricles. We see that there is effacement of the frontal horns bilaterally. Also, corpus callosum is a little bit flattened. Okay, so when we see a mass, we have to first of all decide if it is intraaxial or extraaxial. So there are some clues. First of all, when you look at this mass very closely, you see that surrounding this mass, this is a T2 isointense mass, surrounding there is some areas of like CSF density or CSF isointense material between this mass and brain parenchyma. If I show you this like more closely, for instance, you look at these areas, you see that we see some CSF signal that is just separating the actual lesion from the surrounding brain parenchyma. You see it here very well. So this is called CSF cleft sign. It means that this mass basically is just getting separated from the actual brain parenchyma by this CSF cleft. And then you see that there is this area that looks like a cortex to me. So this is like cortex is gray. You see that this cortex like here. So these are the cortex that you see that is separated from the mass by this CSF. So basically it means that between the mass and the white matter there is a like some cortex here that is left. So basically the mass is separated by a CSF cliff, and there are some cortices behind it that is just getting compressed. There are some surrounding vessels, as you see here. There is this vessel, there are these vessels that they are displaced by the mass. So these vessels, they are not going through the mass. So basically in contrast, they are just getting displaced by this mass. And the other thing is, if you have a CT, sometimes when we have very like extreme cases, sometimes we have like bony changes in the adjacent calvarium. So for instance, in cases of meningioma, you usually get hyperostosis in the bony calvarium adjacent to it. So here I don't see that much in the bone, specifically on MRI. It's really difficult unless it's very like severe. So look at the bony structure to see that this lesion, what it does into the underlying skull. Is it like lytic, or is it a sclerotic? That just gives you more information to just make a differential. So first of all, you need to say, is it intraaxial or extraaxial? And then you have to come with differential. Is it benign or malignant entity? So this one, so as I said, based on all these things that we discussed, looks like an extraaxial mass because we have a CSF cleft, we have all this displacement, we have this cortex that is separating the mass from the underlying parenchyma. And then we see that something weird, that in the white matter, we have some abnormal white matter signal. So this is because this lesion is, we have another one here basically. So we have these lesions that they are different grades. So meningioma has 3 grades. So when we get to more atypical meningiomas, we're going to have more invasion, or they are more aggressive, and they're just causing some edema in the adjacent brain white matter of the brain. Okay, so because we just discussed about meningioma, let's look at some imaging features of meningioma. So here we see that this is the arterial spin leveling, or ASL sequence, that basically is a perfusion technique without contrast administration. This is just very useful imaging sequence that gives us a lot of information about the shunting, AV fistulas, about different tumors, like tumor progression, recurrent tumors, all this stuff. So you see that this is a very characteristic look for meningioma, that they are bright on ASL. so it doesn't mean anything bad. So basically, meningioma are usually ASL broad, they are hyperperfused, they are very vascular, and as you see here, we see that this enhancement with some areas of like heterogeneity inside when they get so basically very big. There are some areas of central necrosis. The other signs that helps us to know if the lesion is interaxial or extra-axial is a dural tail. So if you look at this lesion closely, you see that there are some dural tail or enhancement going into that adjacent dura. Like right here, this is small, you see that this tail over here and this tail over here that just connect this mass to the adjacent dura. That shows us this is also another feature for extra-axial mass. So just remember, when we look at these like brain lesions, we need to make this distinction. First of all, is it interaxial or extra-axial? We use these different features that I just discussed to decide what type of tumor is it, and then after that, we're just coming to our differential diagnosis. Is it a benign meningioma or other like dural-based masses or other like entities? We have a lot of lesions that they are dural-based, and they are not just like meningioma. We can have sarcoid, we can have lymphoma, we can have dural-based metastasis. Just remember that step by step. Just go through your search pattern and try to define, is it intra or extra-axial mass. So if you like this video, please don't forget to subscribe and follow me to see more interesting entities in the future. Thank you.